The wonderful aspect about military medicine, if you will, is the ability to communicate across language barriers. If we're taking care of a critically ill patient, it doesn't matter whether that's a Japanese patient, an American soldier, the kind of care that's involved is something that's understood across boundaries. MEDEX 12 represents the first time an exercise of this type has occurred in over 12 years. Preparing for this exercise with the working idea that we would be assisting in a natural disaster that requires coordination not just from the military standpoint, but also from the Japanese local governments and prefectures. This has become even more relevant in this day and age with natural disasters, as we saw with Katrina, and more recently and more pertinent here to Japan with the recent tsunami. The thing we are concerned most with, and this would be true certainly in a natural disaster, is the aspect of what happens if you get a large number of casualties that potentially could overwhelm your medical capabilities. That, by definition, is a mass cal. So the training, if you will, our battle drills are geared toward the worst case scenario, which would be a mass casualty exercise.
Shit. We are auto for 2. Leading guard 1. So is 1. Once I get back and everybody's ready, we'll meet at the nose and then I'll clear the floors. 3, 2, 1, inches.
The EMT and the pad and TALK will be notified that casualties are coming in through a 9-line, which is a method that they use to talk about the patients that are coming in and what their conditions are.
Medic 5, prepare to copy 9-line, over.
Send it.
Line 5, 5 Alpha, 10 Lima.
Okay, I need team 1, 2, 3, and 4, please. Okay, they're here. You ready?
This type of environment is exactly what we need. We found that when we went to Iraq in 2007, we had a lot of the soldiers that hadn't been deployed. The training that we're doing here is the exact same that we would do deployed, and it's actually phenomenal training as far as what they would really experience out there. So you can't get any better training than this for a combat situation.
3, 2, 1, engaging. And check 1110. Flight tires 85. We got me area traffic sphere 1-2 is on the go. Back to you, Coda.
The essentials of what you would find in a combat zone or in the event of a natural disaster are present here. We demonstrated that here when we had helicopters landing and simultaneously had an ambulance containing 15 casualties show up at our front door at the same time.
Five, bed, 1, abdominal, portable.
We're not going to move him yet.
Whenever you get the 9-line comes in and you know you're going to get a lot of patients, so you have that adrenaline rush. We already, of course, had designated who was going to be running the actual triage process and deciding who was going to go where. And actually, the goal at that point then becomes to kind of move them through as quickly as possible and as efficiently as possible to get them onto the higher levels of care as you go through the hospital, getting them to the operating room or the ICU at that point, whichever needs be, and then going out and moving on to the next patient.
They start out at the front of the EMT, usually. At that point, they're triaged by a medic, a doctor. At that point, they'll make a determination of the patient's condition, whether it's expectant, minimal, immediate, dead on arrival. Some patients that are expectant, which means that usually they're gonna die in this situation, they'll be taken to a different tent of where they'll be comforted by medical personnel and chaplain services.
Would you put your life in the hands of the individuals in this hospital? And I can say without a doubt, I would have no qualms, no hesitation to deploy into a combat zone or any hostile environment with the individuals of the 325th. And secondly, I would have no qualms about entrusting my life to the kind of care and their ability to treat as they've demonstrated here. We'll see if they're going to gather them.